Friends, today we are gathering here to hear from Basaraj sir about the Nadishwara instrument, which is used to get the pulse diagnosis from a person. And we will get a report also. By using that instrument, we will know that which point should be tonify or which point should be sedate. And all the characters, everything will be there. On report, you will get it. And also at the same time, how you can find out the pulse of a person with your hand. He will explain that also in our class. Now, to get more knowledge from Basaraj sir about this special pulse diagnostic equipment, I am welcoming Basaraj sir. Basaraj sir, good evening and welcome, sir.
Good evening, all. Fine. My voice is audible. Please just text in the chat.
Yes, sir. It's very much audible.
Welcome to Nadishwara session. So Nadishwara, it's a pulse diagnosis instrument. It's mainly aiming to diagnose the organ pattern through your radial artery. I think the most of the students here who knows acupuncture and who knows the TCM concepts, you know the importance of the organ pattern recognition. So that is the final goal of diagnosis of any TCM practitioner. If you want to give the right treatment to the patient, and if you want to get the results within short period of time, the diagnosis plays very important role. So according to TCM, so we have a different way of diagnosis. One we go with the pulse, another one we go with the tongue, questions, symptoms, and many more. So here, to summarize and to sharpen your diagnosis, the pulse diagnosis will help you a lot, because based on pulse findings, based on your pulse, you can ask the question. Based on the pulse, you can correlate your symptoms. Based on your pulse, you can have cross-check with the tongue, so that you can narrow down your treatment such a way that even the one point is enough. If you are unable to narrow down your diagnosis, finally you end up with multiple points. When you go with multiple points, again, there is a chance of erroring more. To avoid all these things, in last 1 decade, we are working on it. If you are able to find out which organ or which meridian is disturbed or stagnated or lower in energy or hyper in working. Anyway, either yin may be excess or deficient. Similarly, yang may be excess or deficient. Both the cases will be there. When yang is excess, we say it's hyper, and fire blazing excess of heat like that. When yin is excess, we say excess of fluid accumulation due to the excess of in energy. There is a chances of either blood stagnation, food stagnation, and even zinc stagnation also. To overcome this, we have to identify what exactly, whether the yin is excess or deficient, or yang is excess or deficient. If it is excess, in which meridian? And what may be the right treatment you can offer to your patient so that they can come back to you within a week with good changes. Everybody is goal that only. We need to find out the changes, the positive improvements in the patient. Yes or no? I think more than 100 people here having Nadiswara and getting great results. And we are here to enhance your diagnosis skills so that you can use your Nadiswara effectively. There is only one agenda. We are started with this. In last year also, we did more than 10 sessions on Nadiswara. Of course, so to get into the concepts of organ pattern and to analyze, it takes uh, quite time, but it's worth investing your time in this because in the journey of understanding the Nadiswara report and organ pattern, you also enhancing your knowledge in the diagnosis and sharpening your treatment. And if any of you facing any challenges in diagnosing the report or facing challenges taking right report, so definitely we will help you here. So we have with Mr. Manjunath, our research partner.
So now you are the co-host, sir. Good evening, Basura, sir. Now you are the co-host. You are muted, sir.
Yeah, thank you. Welcome back. There is a small issues. Is it fine, I think, now?
Yes, sir.
Yes, sir.
Yes.
So why we need pulse diagnosis is the first question. If you want to become a good healer, why we need pulse diagnosis? Anybody? Is it compulsory to learn pulse or it's optional? If you learn pulse, so what will be the role it plays? Some person comes and tells you there's a vomiting sensation or nausea, or they may get vomiting or lose motion like that. What do you try to do? Normal, if you go to the normal doctor, MBBS MD doctor, what they will do? Simply they give some medicines to stop the vomiting. Have you seen any doctors who gives the treatment for the root cause? Yes, Jefferson. Jefferson Prasad, you can unmute and talk.
Can you hear me?
Yeah.
I think I've unmuted.
Yeah,
Can you hear me?
Yes. I'm hearing.
Yes, you've asked a very, but yes, I'm a medical doctor, and sometimes people come nausea after eating food or pain in stomach or abdomen just after eating food. Just give an antacid or something, thinking that this pain abdomen straight away after eating food would be because, and so we would try to cool it down with some antacid, mucin gel and stuff like that. But if we take the pulse, we might not find any problem in the stomach, and the problem might be in the intestine. So you asked a very, I think why we need pulse diagnosis, so that we can better diagnose where the problem is, even in the whole of the intestine, whether it's in the stomach or the duodenum, or is it in the small intestine or large intestine. Does it answer your question, sir?
Yeah, your answer is right as a medical practitioner. Thank you. And one more important thing here. So, with the perspective of Ayurveda and PCM, we will look into the holistic way. Even to digest your food in the stomach, we are telling the role of lungs and role of liver and role of heart and kidneys. Even kidney is unable to create the kidney fire, automatically your digestive fire diminishes. And you might have seen that many kidney patients, so their hunger is collapses and even they are getting vomiting sensation. But when you just look at the patient, you cannot tell you are vomiting or something else is because of the which are the other organ is involved in it. So for that, many scanning and blood reports we take, and we will try to do these things. But pulse diagnosis is one of the easiest and quickest diagnosis. From that, you can find out the which all the meridian is involved in the problem or symptoms, and how can you eradicate with one point solution. So that is the way we can work, and we can come out of that the symptoms person is suffering. Because you may have known that if you go to the doctor, if you say fever, most of the time same painkillers and same paracetamol and same antibiotics will be there. But when we actually diagnose the problem, we understood that the problem in the different area. You can unmute while talking, and later we will make you mute. Okay. Are you audible? Yes, fine.
Yes, sir, it is audible.
Fine, good. So here the target is whatever may be the symptom. It may be diabetes or neck pain or back pain or a simple vomiting sensation or fever or gastritis. The main agenda is you should find out which are all the meridians are involved in this symptoms, and how can you correlate between the meridians and between the organs, and how can you strengthen them. It is, I'm not telling you it happens with one point or one session. It takes few weeks to few months. And definitely one thing I can say, you can put your effort in the right direction. So here, why I am telling the tongue is playing very important role means, through tongue and pulse diagnosis, you can find out the proportionality of the energies in the body. What is the proportionality of the energies in the body? Because in the ancient treatment methodology, either in Ayurveda or TCM, we strongly believe that our all symptoms, it may be acute or chronic, it is because of imbalance in the body energies. Either it may be a tridosha or it may be panchamahabhutas, 5 elements. Do you agree this? For example, if you are feeling gastritis, no doubt, as Jefferson told, if you give antacid, you'll get relief within few hours. Sometimes if you take, within 6 seconds it will work. You feel comfortable. Am I right? It works within 6 to 10 seconds also. No doubt, you are reducing the excess of acid secretion in the stomach. But is there any dead end for it? I took antacid for 2 days or 3 days or 1 week. Now I am fine and no need to take. Anyone felt like this? No. Because Every week, 3 days I will practice in the Baswa Natural Healing Center, and another 3 days I will work for the Nadiswaram. I've seen n number of patients in my research work. They are taking years together and decades together. There is no dead end for it. Unless if you are rising the stomach in energy. You have to rise the stomach in energy, then only you can reduce the excess secretion of the hydrochloric acid so that you can balance it and it can cure it. Am I right? So our ancestors have given a wonderful gift. Those gifts are energy points. In Ayurveda, we call it marma points. In acupuncture, we call it as a acupuncture points in a TCM. Whether it is acupuncture points or marma points, both are giving same effect. The effect is, the outcome is, it is reducing the excess stomach heat so that it is reducing the secretion of acid, and it is raising the healthy fluids, the enzymes in the stomach. And through a pulse, you can also understand which are all the meridians which is triggering the stomach to secrete excess of gastric juice. That is the glory of pulse diagnosis. You are not only treating the symptom, you are also treating the root cause. So maybe 3 or 4 or 5 or 6 sittings, you can properly give based on the pulse diagnosis, and patient will cure completely. And I can give you assurance, at least for few years, you won't get that issues unless he again creates it by taking lot of spicy and lot of crispy and lot of fried foods. Because all sour, crispy and fried, and which is dry in nature, if you take those type of foods, automatically it reduces the stomach in energy or stomach fluids. Again, it is make you prone to the stomach heat excess, or it is reducing the stomach in energy. So as a healer, it's your responsibility. As a healer, it's your responsibility to guide the patient after the treatment. Yes, so this is according to pulse and according to Nadiswara. This is the root cause. I solved with these are all the points, and you are okay now. And what are all the mistakes you should not do? That is more important. Which are all the mistakes you should not do? Again, those suggestions, it may be a food, or it may be lifestyle, or it may be a exercises, that will vary from meridians to meridian or symptoms to symptom based on the diagnosis. So that's what I'm telling you, why we need pulse diagnosis is, through pulse you can understand the energies of the body. Next question may arise: how we can understand the energies of the body? Is it possible to understand the energies of the body? It's very simple. See, I will take different objects. Just in front of me. Look at this. I'm touching the phone and one small visual. How I touch? If I touch this, so even if I touch the a simple tape, if I touch this auricular seed, if I touch this pen, all this is a different experience. How I touch these objects. Is it clear? Are you feeling different experience of touching each object? Is it same? You feel? If I touch this, and touch this, a different experience. So why they are in different experience means they are in different shape and different pattern and different sense. So similarly, in your body, if you have too much of water content in the body or too much of dryness, means lack of fluids in the body, or too much momentum in the body, or too much heaviness in the body, depending upon your energies or your symptoms, definitely the blood flow into the vessels will change. So I will show you by drawing a simple example. Look at this. I'm just drawing a few lines. Just imagine this is your skin. This is your blood vessel. This is your what we call radial artery. The depending upon your amount of blood and depending upon the quality of the blood, depending upon the nature of the flow of your chi energy in the body, it will vary. One person, one pair, one pulse maybe come like this, and similarly another one, it may be come like this. It is possible, no? And some other maybe a deeply it will go very slow like this. And another one, it may be floating like this. And other one is simply scatters. All of you have experienced this. If not, just check your pulse nearby yourself and the other person nearby you. Whenever you touch the pulse of different people, There is a different experience. Have you got different experience? Just take 2 minutes time. Yourself check 2-3 people pulse right now. Just touch the radial artery. And definitely you can feel the different pulses which I shown. Slow, fast, no pulse. What else you felt? Which is very deep or superficial, which is very high, low in amplitude. Just check the pulse of yourself and people around you. So someone feeling slow, missing beats. Yes. Now, the most of the people who texted in the chat box, I'm observing each one of you telling a different experience and different observation. Someone is no, larval, I, different way you are telling. So that means the pulse which is changing based on your energy variations in the body. How can we understand those energies? How can we understand those energies in the body? We can understand the nature of your body and nature of your energy based on the shape, the pattern of your body. So I drawn 5-6 different ways. One is it coming slowly, another one is fast pulse, the next one is scattering, another one is deep inside, another one is floating, another one is very rough. You cannot feel the same pulse in everyone. It is different. How? What is the root cause for these variations? The root of all these variations is 5 energies. How your body takes your food, your emotions, how it eliminates the toxins, all these things. It's based on your energy levels. So we are going to understand those energies and those patterns, and not only qualitatively, even quantitatively, how those pulse we can correlate to the human body. Definitely one or other experience you feel, but Nadeswara is making a job of correlating all and quantitating based on your pulse input, and it will generate report for you. Based on that report, you can understand what is the organ pattern, what is the yin or yang excess or deficiency, and based on that, you can plan for your treatment and also food and lifestyle correction suggestions. Is it clear? Any more doubts? How we are getting the energies from the body and how we are correlating. I'll give you a simple one more example to understand you. I've seen a tree, of course. How you feel when you touch the leaf, root, bark, fruit, seeds. Anybody? Because the seeds, leaf, flowers, bark, all are different energies. Different texture, different temperature, and one is smooth, another one is hard, other one is rough. Yes or no? Are you finding differences when you touch the fruits, leaves, flowers, bark, and roots? Similar way and similar energies which is passing within you. When you are at the age of 30 to 45 years, your pulse will be like humidity, and you feeling like the touching the fruits. When you touch the fruit, how you sense? If you see the pulse of 65 plus 70 years old, you feel very rough and stiff and tensed. Why? The fluids are dried up in the body. You are feeling like you are touching the bark of the tree, which is aged, dried. And it is not compulsory to feel the same pulses with respect to different ages. It depends on your energies, how you feel. Are you getting my point? Why we are giving importance to the pulse? This is one of the most accurate and important diagnosis through which we can sense the five energies. We can sense yin and yang, excess or deficient. Any questions here in the first step? Because if you understand now, then only you can understand next.
So Pallavi here.
Yeah.
Good evening, sir. So first, I'm too new to this particular pulse diagnosis, but I would like to understand that when we are talking about the radial nerve, so by mistake, first I took the ulnar nerve, ulnar artery. So I could feel my pulse over there. So is it we have to take it only on the radial nerve?
it's better to take radial artery because it's most superficial artery in the body, so that you can
Okay.
understand better.
Okay, and does the pulse, like what I felt for myself, come at only 2 points, like the three fingers that we place from the wrist joint? Yes. And so I could only feel it on the last 2 points away from the wrist. That is,
Where you're feeling, where you're not feeling, what is the shape and what is the intensity, what is the speed. Based on that, it varies. Okay.
okay, sir.
Your energy level varies, but you are able to feel and you are able to see the different structure, no? And your
Yes,
pulse and the other pulse which you touch.
yes, sir.
Yeah, there is a
That,
difference. Yeah.
okay. Thank you, sir.
Thank you. So obviously, the Shanti is asking, will be the same by checking pulse and device. So you can check through your pulse, through your fingers, as well as from the Nadiswara. Obviously, a Nadiswara is a little trained more than 7-8 years. It will be a better observation you can get. And you yourself also become master in that by yourself spending a few years to observe it. And to learn, you can take Nadiswara and you can learn.
Sir, good evening. Purnima here, sir.
Purnima,
So,
good evening.
sir, on my on my right artery, I'm getting all the three fingers. I can feel the pulse, but on my left, I'm feeling only on the first two.
Third one you are not getting.
No,
Hmm.
but on the right, all the three are beating. Means all in the same rhythm, same volume, everything.
Have you checked the Nadiswara recently?
Right now, I have not checked, sir. I
Recently,
think
1 week,
almost 2-3 weeks before I checked, it showed SP9 point.
yeah, it is showed FP9 means there is a yang deficiency in the body. That's why you are not unable to find out the third pulse. It's a deep inside.
Okay.
Okay. You do one thing, just
Sir,
press K3 20 times. You can see within 24 hours that you can feel that pulse.
okay. K3 20 times.
Just press K3 20 times.
Right, sir. Thank you so much, sir.
Thank you. So what it? So how and the importance of the pulse in understanding five energies and tridosha and yin and yang in the body. Once you get this output, the quantitative output, from there you can read your pulse and you can plan for the right treatment. If a diagnosis is right, so that you no need to give more number of sittings. Within few numbers of treatment, patient will give you a good feedback about healing. Got it? The price of the device is 35,000, and who are attending TM course, there will be offers in the Joshi Kara group. You can just discuss with Joshi sir. He will help you in the device purchase in smoother way and easier way. So can you look at the device? Definitely, I will show you. Even I will show you the how to take the pulse report and all. So this is the device. Here is the sensor. You connect this to mobile. like this. The device will on automatically. Okay. From there, so you can log in into the app and you can enter the patient details and you can take the reports. Just only new thing you need to do is either in the right hand or left hand. First manually you have to sense the pulse. Where you are sensing better, just place the finger, the sensor there. It should be 90-degree and you should not press too deep or too superficial. It will be in the middle pressure you should put. And the moment you put the sensor on the radial artery, you can observe the patterns in the mobile. So based upon that, if your patterns are not coming good, you can retake the pulse by varying the pressure. Once it is taking 20 seconds report, after that you can scroll back and check if all the patterns are good. You can go for the report generation. From there, you can download the reports. I'll just show you the few things. So I logged into the app here and I'll go to the patient list. I click anyone. Here I can go to history. In the history, the number of pulses which we took already will be there, and click anyone. You can view the report. It's taking report, and this is a totally a 7 pages report it will generate. From here, the last you can find out the single point treatment, and you can go here and you can download. See, you can download the report by just clicking here. You can download the report. So the report is downloaded and you can send it the report to the patient and all. And here there is a chances of doing few mistakes. A few mistakes will be there, because if you take the report in the right way, then only Nadiswara will give you the report accurately, and based on that you can give the treatment and you can get the better results. Okay, so have a short 10 minutes break and we will come back, and my friend Manjunath will show you how to take the pulse report without making errors, because most of you are having Nadiswara and taking reports. You may doing few mistakes while taking the report. So today we'll give you a demonstration of taking pulse reports, and we will show you how can you avoid a small errors while taking the pulse. After 10 minutes, we'll come back and we will take one demo report. Okay, thank you. Just wait. Lalita madam, it's 9 o'clock. We'll come back at 9:10. And Mr. Manjunath will give you the demonstration of the Nadiswara. Is it fine? The app name is Nadiswara.
Excuse me, Basara sir, who is the next person, sir? I didn't see one Mr. Manjunath here in this platform.
Wait for 2 minutes, madam. We are setting the.
Okay, sir. Okay.
Hi. Visible? Okay. So for us, 3 complete days are there to understanding Nadiswara. Today, we're just making 2 topics. Why we need pulse. Okay. Through that, how we can understand the 5 energies and 3 doshas based on the patterns of the pulse. That we understood. Now, in the second part, we will understand how to take the report without errors. So Mr. Manjunath will show you how to place the sensor, how to take the right report so that you can avoid the errors. Before that, Junada ji is want to share her experience. Please talk 2 minutes so that you can go for the diagnosis. Yes. Juna, you can unmute. You can.
Hi, sir.
Hi.
Good evening, sir.
Can you open video? I not seen you. I just you purchased recently.
Okay, sir.
Yeah.
Yes, sir. Good evening.
Good evening.
Yeah, I am from Kerala.
You are from
Kerala.
Kerala. Yes, madam.
I purchased the thing 3 months before. It's
Okay.
giving very good results. My condition, when I get the system, my condition was very waste. Means dry cough and all. On night, I get up at night 1 o'clock. Then I check with the system, Nadishra.
Since
So
how long
I
you
get
how long you suffered with that dry cough?
day cough before get Nadishra. I thought 3 months before it is started. Actually, basically, I did single needle acupuncture. So according to that, I was doing some pains, and the cough was cough relief. According to the organ clock, any base, I will needle it, single needle, then it will be okay. But again, it is coming. So I don't know how to balance the pulse energy. So I took this system It is very fantastically working. When I got up with a cough, 1 o'clock, when opened my eyes, then I took this Nadisura and I got liver to sedation. So I thought that is good time, organ clock time, good time. So it is maybe the energy will be increased on that time. I done that way. So when I kept that, after on that time it reducing normally. It is next day it is not like that. It is going on. My condition was means waist means in a heat position. I was no hungry, no thirst, no not getting sleep, sleep disturbance, dream disturbance, sleep. Everything is going on that time. But now it is more okay. More means frequently urination. Everything was there. But not fully okay, but within 3 months, I got some so much difficulties are over. So thank you so much. Actually, this was wonderful system for our family. It should be in family kit, I thought. Anyway, thank you so much for your team.
Thank you.
Then thank you, Joshi sir, also for giving like this one opportunity to normal pupils. Okay, thank you, sir.
Thank you, Junaji. Thank you, Joshi sir, for supporting us to fulfill our dreams. Our dream is to, like Juna madam, we want to see every family in this country should have Nadiswara and they should avoid the medical bills. And they should avoid lot of side effects from the medicine. We are putting our effort. It's not one man show. There is a team which you can see here. Okay. So, Mr. Manjunath. Hi. And Mr. Pavan Kumar. Hi. So this is our lab working area. And so before going to a small demonstration, we got one patient right now here only. Let's start with him. So, hi. Hi. How are you? Yeah, can you talk? So what is the issue right now?
Yeah, basically I'm feeling, when I breathe with a noisy air, like a air polluted one, so I feel some kind of irritation in the nose. So sometimes when I try to cough, I feel a bit of blood in the mucus. So that's the issue that I'm facing now.
Any other things you want to tell? How is your digestion?
Digestion is normal now.
Normal. Good.
Fine. No issue.
Elimination?
That is also normal.
Sleep?
Yeah, that is also fine.
Super. So he's complaining very clearly some issues in the mucus and with air pollution. So there is some variations in the breathing and nostrils. So even we don't know, we didn't check his pulse since long time. So let's take the pulse now. Let's check how it is giving. You take that now. So I'm just moving my camera here and he's placing the sensor.
So good evening, everybody. So here we recommend, the first part is like how to take the pulse. How to take the pulse using Nadiswara. So here we recommend to follow the basic tradition method, like how we check the pulse manually, because we used to feel the pulse by putting our 3 fingers. So at 3 different locations. So in Ayurveda, we call these 3 locations as Vata, Pitta and Kapha. So we recommend the similar procedure to observe the pulse manually. And after observing it, And here in Nadiswara, we made a system in a very simple way that it requires you to take the pulse at only one position. You don't need to worry about the remaining two positions. So just take only one position. Identify the position manually at which you are feeling a maximum sensation. Right now, I am feeling a maximum sensation at this position. So for Nadiswara, it needs only one position. So right now, I am feeling a maximum sensation, pulse sensation at this point. So just place your sensor exactly at this position, so which is perpendicular to the wrist. Now once this is done, this is a system version. Actually, this is a desktop version software. We have a button here, start acquisition. And similarly, in the app side, we have a option called retake. So just click on this and make sure that you are getting a proper rhythmic patterns. You can observe here, I can see a regular rhythmic pattern of pulse. So timer is also running. We recommend you to take the pulse for continuously for 20 seconds. And some customers, they have complained that while taking the pulse, they are telling a problem that, so every time when we take the pulse, the app is saying that the pulse is not acquired properly. This is because actually there is some intelligence which is running inside the system, that every time when you take the pulse, it listens for or it waits for proper data. Because the nadi is a very vital information. We cannot lose even a single point of data. A small change in pulse carries much information. We cannot lose the data. So keeping this in mind, we made a system in such a way that while taking pulse, if you make any mistake or if you give any pause, system throws an error saying that take the pulse properly. So make sure that you're getting the proper pulse for continuous 20-second duration. And once that is done, you can click on the analysis, or in the app, we have an option to generate the report by clicking on analysis button. And once that is done, yes, and you can see this is the 5-element pattern we are getting for this patient. So it's over to Basura sir now. Let him explain the 5-element combination.
Okay. So let's see the 5 elements now. Okay, fine. It's a wind humid combination, means it's a liver heat. Okay. So in the liver, there is a humidity. So now, so when you check even manually also, you can just feel there is a wind is excess in the body. So due to wind is blazing up, it is creating heat in the lungs and throat and dryness. So I'm just using 1 point to clear it out. I'm just reducing the liver heat so that his nostril become moistened and no more blood in the mucus. So the liver is too high. Due to that, the nostril is dried up, and due to that, when external pollution is rises, even it become more dry. With that, it is creating the bleeding. So I'm just reducing the liver heat. I'm just applying one Metis heat on liver 3 just for 10 minutes. The problem will be solved 1 or 2 days. That's it. So if anybody, if lung problem is there and nose bleeding is there, you no need to treat lungs. So you can check it out to what is the root cause. The root cause is liver heat. So liver humidity means it's a liver blood deficient. Due to liver blood deficiency, the liver heat is rising up. Okay. So with the liver 3 sedation, actually it increases the blood in the liver. In turn, it reduces the liver heat. In turn, it reduces the lung dryness and nostril dryness and clears the small bleedings there. Clear? So it is a end to end. The first step is you have to take the pulse in the right position in the right way without adding any noise or errors. So for that, Manjunath will give you given the guidance. So how to take the pulse and how to place the sensor and everything. So on that, we made one manual also, how to get the report in the right way. We will share you in the Joshi Keda group. And the next part is based on the 5 element analysis. So Nadiswara will generate you the one point solution. By just applying 1 point, you can get wonderful results. Okay, it may be acute or chronic. If it is acute, it will be solved in 1 or 2 sittings. If it is chronic, it takes a few months effort. Okay, and you can see the great improvements every month. Okay. So thank you very much. If you have any questions related to taking pulse and reading report, so you can ask. Report, especially 5 element analysis, we will start from that tomorrow. Okay. Today, the concentration is what is the importance of the pulse and why we are acquiring that. And the next part is how Nadiswara is taking pulse and giving the report. Okay. So thank you very much. If you have any questions, please welcome. How to sign up for Nadiswara app? So Nadiswara app we won't release in Play Store. Maybe we'll do in the next version. So right now, which is there, which is customized one. So you can't log in without having the hardware sensor. So if you have a hardware sensor, then only you can log in into this. So in this, the Nadiswara is indicating liver 3 sedation. After report, you need to check maybe after a week or after 2 weeks, you can check once again. Okay. Yes, Murugada, you can unmute and talk. Muruganandam.
Yes, hello sir. So actually, unfortunately, my network is not worked, so I lately joined.
Okay.
So this, but I saw that demo, whatever you are showing. So what actually what the demo the Manjunath sir told is just we need to check that pulse. Maybe one position is checking in only one hand, right?
Yes.
He is not checking in another hand.
No.
Right. Okay. So in that case, the only one hand checking is enough.
Yes, sir. This Nadiswara is not based on the amplitude of your different position pulse. It is completely based on the pattern. As I told in the earlier session of the class, different patterns. The dryness pulse will be there and wiry pulse will be there. There is a different shapes in the pulse. We are concentrating on the shape of the pulse rather than amplitude of the pulse.
Okay.
So that's what any hand one position is enough to get that pattern.
Okay, so that means so in the right hand he checked. So out of 3 in the one position, he told that the pulse is sensation is more. Yes. So we no need to check left side.
Not required. Any one hand is enough.
Okay, any one hand is enough. Okay. Okay.
Okay. Thank you.
Okay. So, and one more thing is this software, whatever is showing software itself. So it is a 5-element problem. It is shown up. Apart from that, it will also advise us what point it will be given. So you selected now, right now, live 3, right?
Yes.
That
Yes.
is it is a system is showing, or your knowledge you are selecting?
No. System itself, it is showing.
Oh, that intelligent is having.
That intelligent is there. Based on the 5 energy values, it will identify which organ pattern. Based on that, it will give you 1 point.
Okay.
Okay.
Okay. Thank you.
Yes.
Sir, good evening. I am Dr. Surinder Vora speaking from Gurgaon, Haryana.
Good evening, sir. How are you?
Fine, sir. How are you?
Doing great.
In the last session, I think on 20th itself, 20th May, I raised some problem about my wasting of muscles and losing of weight and all that. And you advised me to send you the Nadi Sudha report, which I sent immediately. And last Thursday, you suggested me tested 3625. The miraculous result is that I am almost 90% okay. There is no problem of IBS. And the very good thing is that I have gained 1 kg weight in 1 week only, sir. It is really a miraculous thing, I was under so stress, under so much stress. I was thinking that it can't be now rectified. But you have done it, sir.
Switch on your video. I want to see your happy face.
Just 1 minute. I will come.
Yeah, you can get results any chronic disorders. Only thing is you should have belief on yourself, on your treatment. The second thing, you should have patience. That's it. Nothing else is required to get the best results. See, Sudhendra ji is waited for the suffering with a few months and lost weight, and many things happened.
Yeah, for the last 6 months, sir, I was suffering from this problem, waste of muscles and waste of loss of weight. I was really thinking that I should go for the allopathic treatment now, get myself admitted in some hospital and go for all the tests. Why it was happening, for me, when I was so active, I was doing yoga, everything, for morning walk as suggested by you. But this time, you had done a really miraculous thing. Earlier also I have noted so many things, but this time, now you have saved me from going to the hospital. I am not going for any treatment other than your treatment, sir.
Thank you very much, sir. So you chosen Nadiswara, I think 1 year back or 6 months back.
Yes, it is 1 year back. Yes.
1 year back you took the device.
Yes,
so
sir.
Only agenda of our team is God given everything to us. We are happy, but we have to give something back to society and want to see the happy smile like you with 1 point miracles. We are
Rather, I will suggest everybody who is attending the session that they should definitely buy this one Nadiswara. And anybody from NCR, Gurgaon, if they want they want to see the demonstration, I will welcome them to my house. Anytime they can come and get the results. I will definitely devote time, telling them, or I will definitely demonstrate them the miraculous. I am 70 years, sir. I am 70 years.
70 years.
But you are my guru. I have told you earlier also. You are just 35, 36, but you are really my guru, sir.
No,
I don't have words.
I took the Nadiswara and doing wonders.
Yes, sir.
I'm very happy. In which
Really,
years you took Nadiswara and doing miracles, we are very happy, sir.
yes, sir. It is really a miraculous thing, and you have done a lot of service to the nation, to the people of India, to our society people. Really a marvelous thing, sir. Hats off to you, sir.
Sir, thank you for believing in us and supporting us, because we've seen our team, just youngsters of average is 30 years. We're just putting hard effort and putting hard work to make it true. But it is only possible people like Surendra Arora and like these people, they supported us and believed in our technique. and believed in our research.
Yes,
With
sir.
that,
I am a homeopathy doctor also. I starting taking medicine from homeopathy, but there was not much improvement. Only your 1 point has done miraculous thing. Only thing now I want your suggestion is whether I should repeat it or I should wait for another 15-20 days.
no, when 1 point is giving changes means you have to wait for few weeks. Okay, wait 1 week, 2 weeks, 3 weeks also. Then based on next again you take one more Nadiswara report and you send it to me.
After
At least
15
1
days.
week back you sent the report to me. Based on
Okay.
your analysis only I given the point.
Yes,
So
sir.
you-
Yes, sir.
shall I share your report in the?
Yes, sir. Definitely. Definitely.
Because
You can
yours
share.
is a real-time example. So I took your pulse, you took the report and you sent it to me, and based on your feedback only I treated you.
Yes,
Just
sir.
I will share your feedback and
As per the report, SP9 was sedation was shown, but you took two days at least, for studying my report, and you gave me ST36 tonifier, sir.
yes. Why I given also I'll giving reason right now.
Yeah, the reason you are not given, I wanted to know about that. I didn't dare to talk to you about that.
Yeah, so I will share you a report right now. Just be online. This is how he just contacted me and shared his symptoms with me. Yes, on 5th of May, sir, and
Yes, sir.
15th of May.
No, 15th of May, sir. Yeah.
Can you able to see the that screen?
Yes, I am seeing, sir.
Yeah, you send the report, you send all the details.
Yes, sir.
Then I replied you on 19th. I replied with the 1 point suggesting put pepper seed.
19th or 20th? Yeah, 19th. 20th I started. I did this treatment on 20th.
Okay,
Yes, sir.
let's see. I will download your report. Okay,
Yes,
I will
sir.
open you right now and I will show you what happened within you.
Okay. Very nice, sir. So nice of you.
Yeah, I'm
Really
opening your report.
Really
Are you able to
appreciate,
see
sir.
the report?
Yes, sir. I'm seeing it.
And all of you, I don't know, just text me in chat.
Yes, yes, sir. Clear. It's clear.
Yes. See, even if you go to the any allopathy doctor, even they are treating you for 6 months to 1 year also, it is very difficult to get the results. Because so many people, especially diabetic people, they lose the weight, they are unable to gain. They give a lot of medicines again and again. Nothing is required. The small analysis and the small correction with 1 point will enough you. It is not only making you to stop the weight loss, it is also healing you in 360-degree angle, even physical, emotional, and it will improve you holistically. So this is the report he sent, even date is there and everything is there. And
Yes,
come
sir.
back to the this one. So this is what pattern he got. So it's clearly said in the last, if you want to explanation about fire and water, it's a indeficiency. Okay. So empty heat created with indeficiency. On this, I took 2 classes in the last February. So it is recordings also there available in the Joshi Kerala group. Just go through with that. I'm just telling you the summary of it. Whenever you get the fire and water, it is indicating that indeficiency. The indeficiency happens in the 3 organs, either in the kidney or in the liver or in the stomach. So because earth is the 3rd highest, that is indicating that is the cause. So indeficiency caused due to the stomach.
Sir.
Got it? There
Yes,
is a
sir.
indeficiency. There is no enough fluids to nourish you. The nourishment is lost. Why? Because of the stomach imbalance. Okay. You have to raise the in energy in the stomach. Anybody can you tell you how to raise the in energy in the stomach and spleen? You can choose 4 points, any 1 point to raise the stomach and spleen in energy. One is stomach 36 rising. The second one is SP3 tonification. The third one is SP4 tonification. And fourth one is LI11 sedation. Anyone you can do. But I chosen stomach 36 because there's a lot of indeficiency in the body. So I chosen that stomach 36 is a yang meridian point. It will give you quicker results. So due to that, I chosen stomach 36 tonification. The result is in front of you.
Yes, sir.
So I will take you series of classes to increase your knowledge on Nadiswara report reading. The final thing is, overall took the device, they should use effectively. That is the only agenda, because the device taken by even housewives, even laymen, healers, doctors, Ayurvedic doctors, naturopathy doctors, who's having clinic, everybody took the report. You can take Nadiswara report and you can give to the one printout, or online you can send it to their WhatsApp, and you can charge 500 or 1000 rupees for the report, because simple bed report people are charging in thousands. You are giving very vital information about their energy variations, energy level in the body. You are giving information. Why can't you charge simple 500 rupees? People are happy to pay.
One more thing I want to add here, sir.
Yes.
When I sent you the report, my weight it came down to 66.6.
Yes.
And when you suggested me the point, it came down to 66.1.
Okay.
And when I started it, ST36 applied, it was 66.1. I was so much worried on that day that it is not stopping. My weight reduction is not stopping. But within 7 days, sir, 20th or 21st, 20th, I think, and today is 27. Today my weight is 66.2, 66.3. Either 67.3 or 67.2.
So you increased
exactly 1 kg I have gained, sir. Within 7 days.
No
doctor, no therapy, nobody can do it, sir.
It is done by Nadeswara, sir, not me. So,
but you are the God, for me. You're my guru, sir.
I'm happy to see the.
I should hold my hands. I should say thanks to you, sir.
Thank you very much.
Thank you, sir.
So thank you for your valuable input. So here I want to share you one thing. Nobody will lose anything with Nadiswara. Many people, they called and they said what they invested, they got money within 1 month in their clinical practice. And it is helping for them very much. Not only in treating the people, to learning the science. Oh, this is the pattern of the pulse, this is the symptoms, this is how it is going to diagnose, and people are learning from it. So through Nadiswara, it is increasing your knowledge, and it is increasing your patient intake, and it is improving your results. So definitely there is a young team in front of you. We are 8 people from different states and different area. So we are putting effort to train you, to make you best healers. Okay. So I think even Joshi sir also giving effort. Since 2 years continuously, every 2-3 months, he is conducting workshops for the Nadiswara at the free of cost. And we should say very big thanks to Joshi sir. Because of him only, we are sharing our knowledge, we are sharing our experience, and I am sharing my research outcome. Everything is happening. Very big thanks to Joshi sir and Lalita madam. We'll see tomorrow evening sharp 8 o'clock.
Thank you, sir.
Good night.
Thank you very much, Basaraj, for your kind words. Now we will continue the session by tomorrow at 8 o'clock. All should attend the session, because once you on this device, you will get the free services from him. And every time he will upgrade after any software updation, you will get the updation also on free of cost basis, and you will get all the supports. Like he said that you will get the free sessions on Nadiswara every 3 months. But thank you all. Good night. Joshi sir, hope that we can complete this session by today, and we'll continue tomorrow.
Okay.